Medical research proves it. Shockwave therapy helps the body heal itself naturally, reducing pain, restoring movement, and helping patients avoid surgery and addictive painkillers. Here's how it works and why it could be the solution you've been looking for. Shockwave therapy has been clinically studied for over 30 years and is backed by scientific research proving its effectiveness in treating musculoskeletal conditions. In 2017, a study in the American Journal of Sports Medicine found that 91% of patients with chronic tendon pain experienced significant relief after shockwave therapy. Another study in the Journal of Orthopedic Research found that 78% of plantar fasciitis patients avoided surgery after receiving shockwave therapy. And most importantly, thousands of patients at clinics across North America are experiencing life-changing results every day. How does shockwave therapy work? Ever wonder why glass on a building might shatter from an explosion several miles away? It's not caused by the explosion itself, but from the sound waves traveling through the air. Similarly, shockwave therapy uses acoustic sound waves to cause nano-trauma to unhealthy tissue, triggering the body's natural repair process. It fills in these cracks in your tissue with your own body's natural regenerative properties, such as oxygen, stem cells, and nutrients to heal the affected areas. Think of a trampoline in the summer, soft, flexible, and bouncy, just like your healthy tissue. But in the winter, ice forms, making it stiff and unyielding, similar to scar tissue, fibrous tissue, and calcium deposits. Shockwave therapy breaks up that ice, turning that unhealthy tissue back into healthy tissue over a number of treatments. Our shockwave devices are built on years of research with preset treatment protocols, ensuring consistent, effective results. It's been trusted by clinics, universities, sports teams, and Olympians around the world. Safe and more affordable than high-cost alternatives. FDA registered and supported by top-tier medical research. Take the next step. You don't have to live with pain.